My name is Melissa Pless, and this assignment is for course NUR 3065C. This is for the fall semester. My scenario is number 14. I have selected GERD-Q questionnaire as being the skill that I'm going to perform on the patient. The reason that I have selected this skill is because it assesses whether the patient has GERD or not and verifies if further testing needs to be done. The information that be obtained from performing this skill as it relates to the patient's scenario is it's an easy skill to perform, and it evaluates if further testing needs to be done. Typically, the doctors will do a CAT scan to rule it out completely. The references provide more detail on how to perform the questionnaire and how GERD can be related to other factors. However, according to my references, there's no gold standard test to diagnose GERD. It is usually diagnosed by performing a combination of tests such as the questionnaire, endoscope, etc. I am now going to demonstrate the skill by asking these questions. Okay, so I'm going to ask you these questions. You tell me if you've experienced it 0, 1, or 2 to 3 days, or 4 to 7 days. How often did you have a burning feeling behind your breastbone?
About 2 or 3 days.
How often did you have stomach contents, like liquid or food, moving upwards toward your throat or mouth?
Every night, so 4 days.
How often did you have pain in the center of the stomach?
4 days now.
How often did you have nausea?
None.
How often did you have difficulty getting a good night's sleep because of your heartburn and or regurgitation?
No, none.
How often did you take additional medication for your heartburn and or regurgitation other than what the physician told you to take, such as Tums, Rolaids, and Maalox?
I haven't had to use anything else.
Okay. So now I'm going to add up the scores, and if it's greater than 8, then he has esophageal, it indicates that he has esophageal erosions or pH-metry in the esophagus. So in this case, it is 8 and above, so he would need further testing to be done.